to explain us a little bit maybe more about the American Cardiological Society?
First of all, the American College of Cardiology is in its 76th year existence. It was founded by two German doctors, actually, who had trained at Mount Sinai, actually. And it's a very, very interesting story because they wanted a society that was welcoming to all and, very importantly, driving the care of patients with cardiovascular disease. So ACC's mission is to transform cardiovascular care for all. That's everyone, men and women, of wherever they're from, whoever they are. Number one cause of death in men and women across the globe. We have close to 70,000 members, about 17,000 or so outside of the United States, international members. We have chapters in European countries, in South America, Asia. We're very a global organization that really cares deeply about the workforce, because without the workforce, we can't reduce the global burden of disease. We do a lot of advocacy, education, research, and we run large-scale registries and have tremendous strategic pillars that we're working on. And one of them is transforming the care using some digital technologies and tech and AI, and that is really coming forth. We have a health equity strategic priority, as well as getting the guidance to the point of care. So in other words, we work with the American Heart Association very, very closely, with the European Society of Cardiology. We completely realize that we are bigger as a whole rather than separated by society. So we work together.
Now I would like to focus a little bit on the role of women cardiology and how is the current situation in clinical practice as well as maybe in leadership positions.
Yeah, first of all, I think it's really important to understand that heart disease is the number one killer of women. And for whatever reason, understanding the biological differences on how heart disease develops in men versus women, that's never been explored. Sex is a biological variable, and importantly, women present differently. Their treatment patterns should be different, yet all of the guidelines are based on men, because that's who's in our clinical trials. And importantly, the workforce is suffering from lack of women in cardiology. Now, why should that be when over 50% of medical schools, and in Europe, even close to 60 to 75% of medical schools are women? Many of them go into internal medicine as a general medicine and general practitioner. But when it comes to cardiology, the talent drops out. There are just a few women. And in the United States, it's about 22-25% women. And for interventional cardiology, it's less than 10%. And those out in practice could be as low as 5%. So there's something going on that becomes less attractive for women to be in cardiology. And when you think about it, what is it? Is it because it's too much pressure? Well, OBGYN is full of pressure. You have to save 2 lives, and yet 95% of the physicians in OBGYN are women. So it's not about hard work. Women work very, very hard and do extremely well. What is it? And a lot of it has to do with the environment of cardiology. It's not a family-friendly subspecialty. There's toxic work environment, and there's no balance. And especially in procedures, women are perceived. There's this unconscious bias of women being perceived that they're not capable of handling the pressure, which is really insulting, right? And so we believe that there needs to be a change in how we perceive women. And very importantly is the lack of mentorship and sponsorship for women. I knew that I wanted to do cardiology, and I can't imagine any other life and anything more rewarding than doing cardiology. So the idea that we have to think about mentorship, sponsorship, identifying the women, giving them the courage to face the issues, but also changing the environment around them to be more welcoming, more friendly, less discriminatory, Women have to work twice as hard They often make less money. They're given the jobs that men don't want. I'm hoping that we can get there.
As I heard your answers already, to what extent does diversity within a medical team influence the quality of patient care, particularly in cardiovascular medicine?
Many women will say they'd rather be seen by women. And now there's data that shows that if you have a heart attack and your doctor, if you're a woman and your doctor is a woman, you live longer. You have a better chance of living. And we also know that when women are principal investigators of clinical trials, there are more women enrolled. Or if women are designing clinical trials, they are more inclusive of the inclusion and exclusion criteria, so more women could come in. So all of these things are tremendous points that tells us we could make a change and a complete change the trajectory of what is happening in heart disease by having diverse individuals in the decision-making processes, whether it's in clinical trials, leadership, in as heads of departments, in terms of what kinds of programs are being in education and all of those things. So there's no question that diversity really, really will improve how we do things.
You told already a little bit, there are gender-specific differences in the diagnosis and treatment of cardiovascular diseases. How can you better address this problem, more or less?
Understanding that sex is a biological variable, that women are not just small men, is a very, very important piece. You know, right now, if you think about it, all of our devices, our therapies, whether it's for hypertension, diabetes, hyperlipidemia, heart failure, is sort of based on data that comes from men. The devices don't come in pink and blue colors, packets, and neither do the pills to say, well, these are the ones that were developed for women. And we're not asking for that. What we're asking for is, don't approve drugs and devices if they haven't been tested in women. We can't keep piecing the data from multiple trials to try to find evidence for women. And at the moment, we're really poor in evidence. For example, plaque formation, because our biology is different and we are complex individuals and we are proud of that, we have hormonal variations throughout our lives. And imagine that every clinical trial excludes women of childbearing age. That's 4.5 decades of our life. It's more than half of our lives that we're not included in clinical trials. Why are you completely excluding women of childbearing age? Make sure they're not pregnant. Make sure they're using pregnancy avoidance. We know how to do this. And to be part of the clinical studies. And I think we're getting there, but I think it has been one of the things that we've been working on for many, many decades now.
Is there any advice you would give a young female physician considering specializing in cardiology?
If you love it, it's the most rewarding field. You travel the world when you separate yourself because it's a global problem everywhere. It's the most common disease with the highest level of morbidity, mortality, and you will make a change. You could really be part of that change. You could be transforming cardiovascular care with every patient you see in the office and every patient you treat in the procedure room. So I think it's fantastic. But for women to do this, I think they need to make sure that this is their passion, that this is what they want to do, but to not be deterred by the negative environment, because the world is that way now for everyone, men and women, who will get discouraged when they fail. And I constantly think that every time I fail, it's a great opportunity. I think of it as a boost, not as a failure, but as a boost, because in failures, we learn so much. So if you love the cardiovascular pathology, physiology, and you want to make a difference, this is a place where we need, very talented individuals who care deeply about patients.